My name is Steve Piazza. I am a professor in the Department of Kinesiology here at Penn State. The questions I'm interested in answering are about how the structure of the musculoskeletal system relates to our ability to use those muscles and tendons and joints and bones to move around. Specifically, I'm interested in the joints of the legs, the ankles, knees, and hips, and how that enables us to walk and to run in an efficient and optimal way. In my lab, we're making measurements of the structure of the foot and ankle, for example, using ultrasound. We might be taking pictures of the tendons sliding underneath the skin. We might be using an MRI image in order to understand the leverage that muscles have in order to produce the motions of walking and running. We might be making measurements in human subjects, walking and running, measuring the ground reaction forces at the same time, and then using all that information to try to understand how the muscles are producing the motions of locomotion. If we can understand some of those more subtle factors, then maybe we can design strength training programs that will help older people remain more active later in life. Or maybe what we're going to learn from this is things that are done even earlier in life, in childhood, that give you the skeleton and the joint structure that you have that may determine your ability to move around much later, 70 years later, in old age. I think we're just scratching the surface of what we understand with respect to how our muscles and our joints allow us to move around. And I think that we are just beginning to understand how the structure of the limbs, the structure of the joints, the architecture of the muscles, how all those things combine to produce an optimal movement.